Music therapy is primarily used to condition a patient so that he perceives lesser amount of pain. Namaste. Welcome to Pronoun Talks. In today's episode, we'll talk about music therapy. Music therapy is an age-old tradition to alleviate pain. If you ask me whether the music therapy itself is capable of reducing pain in chronically ill patients, it may not be. People who are suffering from chronic pain, for them, music therapy helps to give solace and relief. Yes, music has the power to inspire people, to energize people, and not just that, to soothe their worries and pain, to make them much relaxed. Yes, this therapy is aimed at conditioning people so that they don't perceive that amount of pain which they used to. Music therapy was in use since thousands of years, but it's emerged as a therapeutic tool only from 1940s. In US alone, there are 70 universities that teaches music therapy. So now we know that music therapy is not a simple technique. It definitely requires the therapist to know psychology, to know counseling, even the basic anatomy, the basic physiology. These are the basic syllabus that they need to cover for becoming a music therapist. And of course, a knowledge in 4 musical instruments, including vocal. The first one is piano, then violin, then vocal, and any other instrument of their choice. Interesting, right? Now let us get into details of music therapy. How does it work? Music therapy is able to make the people relax, and they also make them concentrate on their breathing pattern. So many times, along with the therapy, music therapy is given as an associate treatment, an accompanying treatment. So what happens is that people get automatically tuned to feel less pain. As a result, they are de-stressed. So to alleviate anxiety and stress, music therapy is being in use, and also when there is chronic pain. Michigan University, they offer classes for individuals, groups, families. So music therapy has got a lot of importance. And many times, music therapy is not limited to pain management. It is also given for people who are suffering from allergies and acute immunodeficiency diseases. So in every cases, we recommend music therapy along with the other proper medications. So let us examine how this music therapy works. According to Rafi Magdajan, the professor of allergy and immunotherapy, he suggests that once you are having pain and if you are listening to music, it actually works as a gate control therapy. So you are concentrating on music, and what happens is that the neurons are not able to perceive the amount of pain that much if you are listening to music. That means we will not be able to concentrate on both at the same time. So the neurons are busy concentrating on the music, and many times the pain sensation will not be felt in that much of intensity as otherwise if you are not listening to music. When we are listening to music, serotonin, noradrenaline, and endorphins, the feel-good hormones, are released. And these hormones are capable of reducing the pain sensation. And not just that, once you're listening to music, once you're playing an instrument, once you're listening to music, or once you are singing, so in these cases, the pain signals will not be, the neurotransmitters are not able to send the pain signal to the brain because the gate will be shut. Exactly the same way when you take a painkiller. Because by painkiller, we are not actually rooting out the cause of pain. What we do? We are trying to shut the gate so that the brain doesn't feel the pain. The same way, music therapy helps like a painkiller. It shuts the gate so that the pain sensations are not felt to that extent. always remember, music therapy may not be a pill that can instantly shut the pain sensations, but it can definitely train a person so that he perceives only lesser pain. He gets conditioned to it. And again, the most important factor is it doesn't have any side effects. You're still not convinced, right? So let me explain it in this way. See, I'll give you an example. You're visiting a dentist, and if you are a person with an excessive gag reflex, you tend to have that puking feeling every time the dentist is trying to examine your mouth, and he's doing the cleaning or whatever it is, be it a dental treatment, whatever it is. So once your concentration is completely on the procedure, on the movements of his hands, then definitely you'll be more nervous. So what do your dentist say? He asks you to concentrate on something else. So once you are concentrating on the music that's being played in his clinic, or once you're concentrating on the videos that's being played on the TV, so once you are distracted, or if he asks questions and if you're trying to answer, so however, if your concentration is not on what exactly his next move is, then what happens is that you feel less amount of pain. So this way, the music also helps. I would like to conclude that every holistic medical centers should advocate music therapy for everyone, not just those who are suffering with pain or suffering with allergy or immune deficiency disorders, but everyone. Music should be part of us. Thank you.